I am Tia-Roe, and I am here to present the challenges to patient engagement of healthcare technology. I would like to start with my take home. This is so that you know what we want to talk about at the bottom line. Technology is the way forward. It's inevitable. We are growing more and more into using technology in all aspects of our life. However, streamlining a system will help keep things simple and consistent. It'll allow patients better access and access with ease and confidence. Technology is just an option. Technology does not replace other methods of receiving healthcare, specifically in person encounters. Technology is just an option specifically for the generation coming up. Also, more data is needed for other populations. We are not capturing these populations who are not tech savvy. We're not capturing these populations with a different economic status or a different education level. So more data is needed. First, what is engagement? Before we can get into healthcare and technology and what this means, we need to know what is patient engagement. Patient engagement is the idea that both the patient and provider are involved in everything. So this includes designing a care management plan. The goal is that both persons are involved. This is helping patients decide on the treatment plans. The goal is that the patient is leading the way. The patient is picking and choosing what they feel comfortable with moving with their diagnosis. The goal is that the provider is not dictating everything. It should be a collaboration. Engagement includes sending appointment reminders. We all can appreciate an appointment reminder. We have so many things going on. We have so many notifications coming through our phone. Appointment reminder helps us to stay on task. Engagement includes following up on medication. So this can be a doctor sending a message out to a patient to make sure they picked up the prescription, or vice versa. It can be a patient letting the doctor know that they picked up their prescription and maybe following up with, do you think I should take it in the morning or evening? This engagement improves outcomes. That's the ultimate goal. And engagement also includes updating patients on lab results and diagnosis. If I know my lab results come out today, it's easier for me to hop on the computer, look at my labs, and know what's going on. It's easier for me to look at the lab results and follow up with some interventions below. It helps me to utilize all of my resources. The engagement can also provide patients with additional resources like classes. So, ma'am, you were diagnosed with high cholesterol. This clinic has a class on Wednesday at 10 a.m. This allows the patient to click, view schedules, compare their schedules, and actually take charge of their healthcare plan. As we move on to challenges, these are things that we need to consider from both parties, so patients and providers. More training will be needed. In addition to a provider having to do training to keep their credentials, training for patient safety, we're now asking providers to become proficient in technology because they are leading the way. The patients are coming into this situation thinking that the providers know how to use every resource on this computer or on this device. So more training is needed. With this training, it grows the business responsibilities. So we're in charge of scheduling appointments that are virtual and in person. We're in charge of so many aspects, following up on messages, sending out reminders. Another challenge is budgeting for additional technology. Do we have enough tablets for all of the providers in the workspace to use? We have more patients using technology. Are we able to meet their needs and provide them on the latest technology at that? Some people might have technology intimidation. It's not just the baby boomers that we're considering. We need to really consider Generation X. These persons are 41 to 56. Yes, they were around when technology came, but in the last decade, Technology has really boomed and it is intimidating. Also, do they want to use technology? We can assume that we can't assume that everybody is on this path of technology is the best way. And another challenge is patient preferences. Even for myself, I like technology, but I am more engaged when I'm in person and I'm speaking to a person. So patient preferences play a huge role. How do we know if that patient is comfortable letting you know that they do not know how to work their computer? How does a patient say, yes, I have the latest iPhone, but I still don't know how to check my messages or my emails? How do we get this barrier down? And how do we move smoothly into getting everyone up to par with technology? So, back to our take homes. Technology is the way forward, that's inevitable. However, how we get there and the available resources for those persons who are not interested in technology is one of our key factors we need to still take heed to. Streamlining a system, a simple and consistent access. This helps it for the company in New York versus the company in Montana. It helps us even be accessible to these providers in different states. But it gets even easier. We're all using the same system. If all of the apps look the same, that makes me more comfortable and it allow me to get on there more frequently to look at my information. Technology is just an option. Yes, I came and did a virtual consult with you last week, but this week I would like to see you in person. Let's keep all of the options available and make sure we're getting more data. I don't think, well, I see the numbers are not showing data for persons in a lower economic status, persons with lower education, Generation X. It's not just the boomers, it's Generation X. It just might be millennials too, just based on how fast technology is really moving. My last slide is my resources from where I got my data, my information, and technology is the way. We just have to make sure that we are paying attention to our challenges and meeting our patients where they need to be met.